So hi, my name's Lauren Gibson and I'm the lead pharmacist for Community Pharmacy Services in NHS Lanarkshire. There's lots of stuff that community pharmacy can provide for patients without a prescription, and that's grown all the time. So the main service is the pharmacy first, so it's in the name to go to your pharmacy first for any sort of minor common clinical conditions, and you'll be assessed by the pharmacist and if appropriate given treatment. So common things can be, upset stomachs, constipation, diarrhoea, coughs and colds. You can also access potentially antibiotics if appropriate for urine infections, which is really good, and also antibiotics for any skin infections. So anything minor, first protocol, I would always say go to your local pharmacy. It's walk in, and if appropriate they'll give you medication. If it's not appropriate for medication, they'll always give you really good self-care advice. So I definitely suggest going to your pharmacist as the first port of call. Another service that community pharmacists can offer is the urgent supply of medication. It's particularly good over Christmas and New Year when GP practices are shut, if there's medication that you take on a regular basis and perhaps you forgot to order it or you've ran short of it. The community pharmacies can give you a supply of that medication, and it doesn't need to be your regular pharmacy that you go to. It can be another pharmacy, so it's worth bearing that in mind. I mean, that's your sort of worst case scenario, but certainly as we build up to Christmas and New Year, make sure you've got your regular medication ordered in plenty of time. So make sure you know what your GP practice times are and communicate with your regular community pharmacy. Make sure you've got any sort of self-care needs at home. If you've got young babies, children, paracetamol, things that you might need to hand. Try and be prepared as possible, but it's always good to know the community pharmacist is there. So if you go to community pharmacy, say with an eye infection, and the pharmacist has a looks at it and makes a clinical assessment and things, actually this is not appropriate for me to treat, they would give you the right referral advice, whether that would be to the local optician or maybe to the out of hours or GP or A&E. So they'll give you that sort of signposting when you're there. I think that's the beauty of community pharmacy, is it is so accessible, particularly on the weekends, and we have pharmacies in Lanarkshire that are open Sundays as well. So it's definitely worth popping in and getting that advice.